Hello, my name is Luciani, and I like to look for information about our health, and today in my research I discovered the 7 warning signs that can appear in the body when the heart is not doing well. Is your heart okay? Let's talk about 7 signs, which appear in your body, which may indicate that your heart it's not 100%. We know that cardiovascular disease is the #1 cause of death in Brazil and worldwide. Here in the country, the heart kills about 400,000 Brazilians a year, data from the Society Brazilian Cardiology. So stay alert. Let's divide this video into 3 parts. The first part is about the 7 signs, those that you can see that something is wrong. What you should look out for when looking for heart problems. The second part we will talk about the 7 classic symptoms. What do you feel when your heart doesn't go well? Are you or a family member experiencing this? Also at the end we will give you precious tips for you to avoid a heart problem in the future. It will be a very complete video, so stick around until the end and I'm sure there's a lot. Something you've never heard of. But first, I ask you to like the video, because the more people like the video, the more YouTube shows to people who don't have access to doctors or hospitals. Share the video with your friends and family. Many lives can be saved with your help. So share there. Comment here if you have a heart problem or think you do. What part of Brazil or the world are you from? Write down there. So what are the 7 signs you should look out for that could show you have a heart condition? 7th sign, Frank's sign for sure. From today you will start looking at people's ears more carefully. Why? Because there is a little sign in the ear, which can indicate that the person has some blockage in the arteries of the heart, in the coronary arteries, or in the carotid arteries. Back in the 70s Dr. Sanders T. Frank noticed that many of his patients who had angina had a diagonal crease in the ear. And he described that sign as Frank's sign. What is the connection between heart and ear? One theory is that the same factors that damage the intima of the arteries can also cause this crease in the ear. Does everyone who has this sign of Frank have a blockage? No, out of 100 people who have this diagonal crease in the ear, 30 have nothing, being just an age mark, but 70 have it. And the younger the person, the more likely it is to be a sign of coronary or carotid obstruction. So if the person is 40 years old and has Frank's sign, we have to be more attentive than an 80-year-old person, which is probably just because of age. And the sensitivity of this signal is low. That is, out of 100 people who have heart obstructions, only 40 will have this sign. So you can't celebrate if your ear is flat. 6th sign, loss of hair on the legs. Loss of hair, first on your shins and then on your thighs, could be a sign that you have peripheral arterial disease, that is, clogged arteries in your legs. And since atherosclerosis is not a localized disease, but rather diffuse, if you have a blockage in the arteries in your legs, it may be that you have blockages in other arteries in the body, including the coronary arteries, which supply your heart. Most people who have peripheral arterial disease only realize that something is wrong when the atherosclerosis is advanced. And why do they lose hair? Because hair follicles need nutrients for your hair to grow, so they need good circulation. If your arteries are clogged by fatty plaque buildup, adequate blood and oxygen will not reach you. In addition to losing hair on the legs, the person may have smoother, brighter skin, cool skin, and decreased nail growth. But let me point out that also loss of leg hair can happen for other reasons. Not just because of peripheral artery disease. There's the genetic issue too, and besides, you can lose hair by rubbing your pants. 5th sign, Xanthelasma. You must have looked into someone's eyes and noticed a yellow plaque on the eyelid. So this is called Xanthelasma. It doesn't hurt, it's usually just a cosmetic problem that grows slowly. Xanthelasmas are the most common type of xanthomas, which are deposits of cholesterol in the skin. It is more common in middle-aged women and is located mainly in the inner corner of the eye, most often on the upper eyelid. About 50% of patients who develop xanthelasma have dyslipidemia, either high cholesterol or high triglycerides. And look how interesting, only 1% of people with high cholesterol have xanthelasma. But researchers have found that having xanthelasmas increases the risk of heart disease, heart attack and stroke. That's why if you have xanthelasma you have to do a blood test and check cholesterol and triglycerides to make sure they aren't high. Fourth sign, senile arch or senile halo. As the name implies, it has to do with age. It is more common in older patients. It is caused by cholesterol deposits at the edge of the cornea and has that white or gray appearance that is visible above and below the outer part of the cornea. In some people this halo can take over the iris, the colored part of the eye. The person may notice that before he had a dark eye and now it is getting lighter. Arc senile does not affect vision and does not need treatment. But there is a catch: if this senile halo occurs in younger people, before the age of 45, it may be signaling that the person has severe dyslipidemia, that is, very high cholesterol or triglycerides. If so, it is associated with an increased risk of heart disease. If you are elderly and have senile arch, it is normal. About 60% of people over 60 have it, and after age 80 it's almost 100%. So don't worry if you're over 60 and you look in the mirror and find the senile arch. Third sign, cyanosis. Cyanosis is that bluish or purplish discoloration of the skin. Could it be that it's too cold and it's purple? He can. But it could also be saying that you have a heart or lung problem. If an area of your skin appears blue cyanotic or purplish when you are hot, this could be a sign that that part of your body is not getting blood oxygenated, which is red, sufficiently. It could be that an artery is clogged. Now if the person is complaining of shortness of breath, it could be a lung problem, pneumonia, emphysema, pulmonary embolism, or heart failure, when the heart cannot pump enough oxygenated blood. Of course, other cardiac causes also fit here, such as birth defects such as tetralogy of Fallot, which causes cyanosis. Second sign, ulcers. Those sores that don't heal on your legs or feet could be indicating poor circulation. It may be due to arterial insufficiency due to some obstruction in the artery that irrigates that area, and usually people cannot walk a lot or fast due to the legs becoming more tired and painful or even having cramps. Most of the time these ulcers are painful. But if you have a nerve problem, such as diabetic neuropathy, you may not feel pain. And arterial ulcers usually appear on the outside of the leg and heels, from the toes, and usually do not bleed. The other ulcers are venous, which are the most common and have to do with varicose veins or venous thrombosis. Unlike arterial, they affect the inner part of the leg and usually bleed. First sign, swelling in the legs, ankles and feet. This swelling, or edema, in the legs and ankles can be caused by a weak heart or swollen that can cause fluid to accumulate in the body. You may feel that your shoes no longer fit, a tighter shoe. The ankle becomes fluffy, looking like that bread that is baking, when you press it does. That dimple, what we call a locker sign. You are more likely to notice this swelling in your legs and ankles later in the day because gravity increases the pressure in the leg veins. And if you lie down and raise your legs, it also reduces swelling. And what are the 7 symptoms that you are experiencing that you may have a problem with your heart? The first symptom you should be aware of is shortness of breath or dyspnea, especially when you try hard. It's a disproportionate fatigue to efforts. You get more breathless with everything you do. It could be a heart problem. Second symptom, persistent cough with white or pink phlegm. Meaning they have fluid in their lungs, in their alveoli. It's important that you don't let that cough go. Look for a doctor. Third symptom, shortness of breath when you go to bed. The person starts to put more pillows, to see if he sleeps better, and over time he is unable to lie down, he has to sleep in a chair. You can also wake up suffocated during the night, which we call paroxysmal nocturnal dyspnea. This speaks volumes in favor of a heart problem. Fourth symptom, generalized weakness, feeling tired all the time and difficulty in day-to-day activities, such as shopping, climbing stairs, carrying groceries, or walking. This is because the heart cannot pump enough blood to meet the needs of the body's muscles and tissues. Fifth symptom, nocturia. When you wake up during the night, that is, you have to wake up many times at night to pee, this is called nocturia. There are several causes, but if the heart is not pumping properly and at night, this excess fluid needs to be eliminated. Sixth symptom, intermittent claudication. When you walk a few meters you feel pain in the calf. It's not pain, time is when you make an effort, and when you stop, it gets better. This symptom means that. Sixth symptom, intermittent claudication. When you walk a few meters you feel pain in the calf. It's not pain, time is when you make an effort, and when you stop, it gets better. This symptom means that the blood is not getting there the way it should. When you stop, it gets better. When you walk, it hurts again. Seventh symptom, chest pain. If you are having chest pain, the first thing you have to think about is a heart problem. You may not think it's muscle, gas, or anything simpler. Could it be? You can, but you always have to exclude the most serious thing. Heart pain is a pain or discomfort in the chest that lasts longer than a few minutes and can come and go. It can be like pressure, heaviness, tightness, or burning. It may radiate to the left arm, neck, back, jaw, stomach, both elbows, and may or may not have associated sweating, pallor, nausea, and dizziness. If you have these symptoms, you should see a doctor as soon as possible. And now, how to prevent. How to prevent you from having a heart problem. 1. Do physical exercises. Get out of the chair. Do not stop. Physical activity is extremely important for your circulation, for your heart, for your mental well-being. Low-impact exercises such as walking, cycling, swimming can also improve the flow caused by chronic obstructions in veins and arteries. 2. If you smoke, stop smoking. Smoking is one of the worst things you can do for your health. Smoking causes impotence, inflames all your arteries and forms fatty plaques, increasing the chance of heart attack, stroke, and dementia. 3. If you are overweight or obese, lose weight. Excess weight increases your blood pressure, worsens blood sugar, inflames, overloads the heart, kidneys, joints, and venous system, increasing the risk of thrombosis. In addition to increasing fat in the liver. 4. Eat healthy things, lots of fruits and vegetables, fiber, whole grains, olive oil, and little red meat and processed foods. 5. If you have a family history, especially a father, mother, or siblings who have a heart condition, heart attack, stroke, stent, heart surgery, you should be more attentive than other people. If many people in your family suffer from heart problems, you may need to have further tests. 6. Take care of your cholesterol and triglycerides. Eat more oatmeal, cut out trans fats and saturated fats, lose weight, eat more fiber, exercise. And even doing everything right you can't reduce it. Don't be upset if your doctor prescribed medicine. 80% of cholesterol is made by the liver. Even doing everything right is sometimes not enough. 7. Keep your glucose under control. If you are diabetic or pre-diabetic, controlling your glucose levels will reduce complications. Glycated HB has to be below 7. 8. And finally, control your blood pressure. Your goal is to maintain a blood pressure below 120/80. For some, the goal might be less aggressive, like not being greater than 140/90. And of course, if you think you have a heart problem, if you see several signs and have some of those symptoms that I just talked about, go to a doctor, explain it to him, and follow his instructions. Did you like the video? Remember to share so that more people have this knowledge. And what will be the next video you're going to watch? I'll leave 2 recommendations next door. Don't forget to subscribe. And until the next video. Thank you very much.